for further analysis, let's bring in Mads Gilbert, specialist in emergency medicine, senior consultant and professor emeritus at the University Hospital of North Norway. More importantly, a man who's worked in Gaza, who has colleagues in Gaza, and has written a book about the territory. Mads, this really is a stark story, a really sad story that we bring you this morning. But it's not isolated, is it? It's happened time and time and time again. But the horror of this one is these children were queuing up to get supplements because there's not enough food in the territory.
You're right. You're absolutely right. And I think the good people of this world are asking themselves, we all do, how is this allowed to continue to go on? I mean, they have killed maybe as many as 17,000 children in Gaza only during the last soon 2 years. And it seems that the world order is breaking down, that a government, an armed governmental army is allowed to perpetrate these immense crimes against innocent civilians. It is beyond comprehension that children, women, pregnant women are being slaughtered day by day as the Western powers are standing by and only mumbling, not even trying to use the tools that we do have, peaceful political tools of sanction, of isolation, of economical pressure, as the West have been using on Russia with the Ukraine situation. So I am appalled by the passivity and the complete lack of moral standing in the Western powers, because they can make an influence and a difference. And you know, I talked to the Minister of Health, Dr. Youssef Aborish, last night, and he said the situation in Nasser Hospital and in Shifa Hospital now is beyond critical, because he said the three most important things is safety, safety, safety. Nasser Hospital, which is the largest and only functioning hospital in the south of Gaza, is surrounded by Israeli tanks. Snipers are shooting into the hospital. And where people are supposed to get access to security and medical help, they actually now flee the hospital before they are finished with their treatment in order to try to. Number two, the staff of Nasser Hospital and wounded children cannot access the hospital because it is in a red zone. And the second thing with Nasser is bed capacity. They have 340 beds normally. They have more than 600 patients now. And in this security situation, with the Israeli occupation army surrounding the hospital, attacking it and denying staff and patients access, you know, this is almost beyond comprehension that a state army can do this without repercussions.
And that's not to mention the critical fuel supply shortages and the shortages of medical supplies for doctors to treat people with. I mean, how difficult is it for medical professionals, Mads, to have to make these decisions on a regular basis over perhaps who should live and who should die?
It is a massive moral injury to the medical staff. And I know the medical staff in Gaza, the Palestinian staff, very well through the more than 25 years I've been working alongside with them. And I want to really give them my deepest respect and compliments for standing tall in this situation. And of course, as you say, to choose who should we try to treat and who do we have to leave to die is an incredibly difficult situation. And many of the patients coming in, don't forget, are family members or relatives or neighbors of the staff themselves. So it is like being a professional without having the tools to work, an electrician or plumber, whatever. You are lacking the most basic needs of anesthesia, medical equipment, medical disposables, which is not denied them because of some difficulties in the supply chain from an earthquake or a natural disaster. It's done on purpose. All of this is 100% man-made, intended to, number one, kill Palestinians as part of the ethnic cleansing, and number two, to scare the staff and to scare the population from using the hospitals. It's a double attack. So for the health professionals, as you ask, it is extremely difficult, and it is with the greatest pain that they have to see people bleed to death or die from injuries that they could have saved. had they had the supplies of medical consumables, of equipment, of electricity, and as you said, very rightly so, and also Dr. Youssef stressed yesterday that it is the fuel and the bed capacity and the medical supplies, in addition to the safety requirement, that is the main problem now. The international community could change this in a day had they put the pressure on Israel and the United States to open Gaza, to lift the siege, and to have an immediate ceasefire. What we are seeing now is going to be the biggest black stain on Western history in our century. Holocaust was the stain in the last century. Gaza will be the stain in this century.
Yeah, and I know as a medical professional yourself, you'd prefer to stay away from the politics, but of course it's almost impossible in this sad story. When it comes to ceasefire negotiations and diplomatic developments that we've seen in the last 12 to 24 hours, I mean, how confident are you that, or how positive are you that Benjamin Netanyahu seemingly addressing a permanent end to the war for the first time may actually bear fruit?
Yes, let's hope, and let's put more pressure. And I think the only conscientious, moral standing army of the world today is the solidarity movement. All the good people all across the globe who says enough is enough. We stand with the Palestinians, stop the massacres, have ceasefire and lift the siege. And if you allow me, Aaron, I'd just read a message that I got from my colleagues in Nasser Hospital just now. They say, quote, "We are working now in the hospital, in Nasser Hospital, and the tanks are only a few meters away from us. We are closer to death than to life. The soldiers show no mercy, not to a child, not an elder, nor a doctor or a nurse. We remain here because we are human and our mission is humanitarian. If these ravens snatch our lives, don't forget us. Don't turn us into numbers. We love life. We have dreams just like you. We have children and spouses we love deeply. But to be truly human means not to abandon those who need your humanity. Tell the world about us. Tell them that we were more human than those who only claimed to be." Last sentence. "Tell them we choose death over abandoning our noble mission and our patience. Do not call us heroes. Just tell them we understood what it truly means to be a human," unquote. My colleagues in Nasser Hospital right now. These people, these are the ones who deserve the Nobel Peace Prize because they hold the moral compass of this world right now. It's in Nasser, it's in Shifa, it's in Al-Aqsa Hospital, and the paramedics and the pre-hospital staff. We need to support them, and I'm very happy to also thank TRT for a coverage that is comprehensive, it's honest, it's true. Don't forget that all the information coming out from Israel is under military censorship. Don't forget that Western media is denied access to Gaza. Had the good people of the world seen the horrors of what's going on with the massacres, of the tent camps, of the people waiting in line to have food supplies, it would have stopped immediately. And that's the blackout. The intention of the blackout is to deny us information, and that's why it's so important that you continue the brave reporting from Gaza. It has to stop. It has to stop now. Enough is enough. More than 80,000 people have been killed, and life expectancy in Gaza has been reduced by 35 years, according to a Lancet study, meaning that anyone growing up in Gaza today would only have a chance to live for an average of 35 years, which is the most dramatic illustration of the genocide and the ethnic cleansing. That is the goal of the Israeli occupation of Gaza and the West Bank. That has to stop. We all have to take responsibility.
Yeah, you're right. Great credit has to go to Ashraf Shannon and our reporting team in Gaza for keeping us up to date on a daily basis. Mads, a really emotional message from the doctors of Gaza there. Thank you very much indeed for bringing that to us. The hope is that we won't have to speak again, as we have done many times about this, and the hope is that ceasefire negotiations will bear fruit and we will see a pause to the fighting. Mads, thank you very much indeed. That was an incredibly emotional interview. Thank you.